A couple months ago, I took a look at the lack of mental health resources for kids in Michigan. We talked about problems and recommendations from an initiative called the Michigan Inpatient Psychiatric Admission Discussion Work Group, or MIPAD. That report found one very big contributing factor to the issue: a shortage of psychiatrists. I wanted to find out why from those closest to it.
In our community here itself, just in the greater Lansing area, we're about 25 psychiatrists short. About 80 to 85% of all our patients are being treated by primary care. And they have, on an average, about 3 to 3.5 months to get into a psychiatrist's office outpatient.
We don't have enough beds available. We don't have enough facilities that can take those patients. And then for outpatient, we don't have enough psychiatrists who can cater to the need.
Well, the federal government defines most of Michigan as a mental health shortage area, which means we don't have nearly enough mental health practitioners in almost every county in the state. Even places we have them, the demand is just huge.
In 2018, the University of Michigan did a research analysis on this issue. Reporting on the data by MLive showed that the state had 1,180 active psychiatrists in 2018. That's about 11 practitioners per 100,000 residents.
You know, I spend part of my time seeing children in the Sparrow Pediatric Emergency Department who are sitting there because they can't find psychiatric beds for them.
Some practices are already full, including mine, but I do make arrangement for a new patient to be seen. Sometimes I have to work extra hours, sometimes weekends.
Michigan's numbers are below the national average, but the pinch for psychiatrists is being felt across the country. According to statistics last year from the Association of Medical Colleges,
we're about 2,800 psychiatrists short in the country, and that's projected to go up to 6,800 short by 2025.
Nobody is turning out enough. We have about 1,000, maybe 1,400 psychiatry residents in the country. So we turn out somewhere around that number each year. That's not nearly enough to take care of the huge burden of mental illness that's in the country.
So we know what the problem is, but why? And how do we fix it?
The average medical student comes out with debt somewhere in the range of $175,000. You know, that's like a house payment.
And in many cases, that dollar amount is much higher.
Imagine coming out of medical school with a debt of $300,000, $400,000. That might have some implications for the field you go into. And so psychiatry is one of the lower earning specialties in medicine. And so there's some thought that some people really move toward the higher earning specialties because of the loan repayment issues.
But there are some relief programs in place.
We have a program called MyDocs, which is supported by the state of Michigan, which provides loan repayment for psychiatrists who in their last 2 years of training go into the Upper Peninsula. So they train there.
MSU has a total of 6 residents in the MyDocs program right now. We also reached out to the Department of Health and Human Services to find out what, if anything, they're doing to address those costs. In an email to Fox 47, Bob Whedon said, based on the MyPad report findings, MDHHS made pediatric inpatient psychiatrists the top priority for the Michigan State Loan Repayment Program. That repays up to $200,000 in medical education debt for providers who agree to practice in an underserved area. They tell me that around 70 providers each year are taking advantage of this program. Shuchi Khosla is a chief resident at Michigan State University's Department of Psychiatry. Born and raised in India, she was once an engineering major, but
I lost a friend to suicide and then decided to do something else with my life. And I decided I wanted to be a psychiatrist. It wasn't just the death of my friend to suicide, it was the societal response to it. How both the family, their parents were essentially ostracized from the community and nobody wanted to talk about it, as though it was something that the person had done as opposed to something that had happened to a person.
Shuchi says more residency programs and recruitment initiatives will help.
We just aren't training enough. Like if we're 2,800 short, most of our psychiatrists are between the ages of 65-ish and 70, which are all set to retire, and that's 1% of the all psychiatrist population. So if we can get younger people in there wanting to come to medical school to be psychiatrists, kind of like I did, then it makes the rest of the journey a lot easier.
There's a pipeline issue, so it takes a long time to educate people. So if you start now, you begin to turn out people 4, 5, 6, 7 years from now. So you got to start to address it now, but the payoff comes later, and therefore put more psychiatrists in the field. We keep about 80% of the residents we graduate in the state of Michigan. So that's great for the state.
Michigan State is working hard to retain talent. An average calculations from the last 4 years shows the school has around 6 people graduating the program each year. Reporting in your neighborhood, I'm Tiana Jenkins.